Welcome to PPE Best Practices for Non-Healthcare COVID-19 Return to Work. The learning objectives are to understand basic concepts of infectious disease hazards and how the COVID-19 coronavirus relates to those basic concepts. Considerations for use of gloves and masks for COVID-19 in the non-healthcare workplace. To learn methods to help in control of infectious diseases and review the differences between masks and respirators. We'll also list controls for the SARS-CoV-2 coronavirus and which link in the chain of infection is broken by them, and an overview of risk assessment approach for determining appropriate PPE and other controls to reduce the spread of COVID-19. So let's start by talking about biological hazards and defining a little bit about what they are. There are a few different categories of biological hazards: bacteria, viruses, fungi, and something that we just sort of lump into an other category. Note that we're going to be talking about SARS-CoV-2, the causative agent of COVID-19, which is a virus. But other examples of biological hazards might include the bacteria that causes tuberculosis, or mold, which could be put into the fungi category. And Giardia is an intestinal parasite that you can ingest if you drink contaminated water. So a little basic microbiology just to ground us in what we're going to talk about here in this training. Microbiology and microorganisms, it's really a science of things that are too small to be seen by the naked eye. So really this science started with the invention of the microscope. And as I mentioned, bacteria, viruses, fungi, and other are the broad categories of these microorganisms. Bacteria might be classified into different types using characteristics like their shape, or their oxygen requirements, or their response to what's called a Gram stain. But viruses is going to be the focus of this training, and the unique thing about viruses is that they have to live and multiply inside of host cells. So bacteria can live and multiply outside of cells, but viruses cannot. They're a little different type of microorganism. Viruses can be classified into two broad types, enveloped and non-enveloped. The non-enveloped are considered a hardier form, in other words, able to survive longer in the environment. The SARS-CoV-2 causative agent of COVID-19 is an envelope virus, so therefore a not as hardy in the external environment type of virus. Fungi and mold usually are something that you might be considered a nuisance or aesthetic issue because of staining, but also certainly could cause health issues. And then the other types of organisms that we mentioned before. So a couple other terms to be aware of. Pathogens are microorganisms that cause disease. So not all microorganisms cause disease. You might also call pathogens germs. But normal flora is microorganisms that are present normally on your body. So think about the normal flora of your gut, for example, the intestinal normal flora that we even take probiotics for. And environmental microorganisms are those present normally in the environment, so in the soil, in the water, in the air. A basic concept of biological hazards and infectious disease is something called the chain of infection. And it's called that because the links in the chain all need to be present for disease to occur. And when you want to interrupt disease transmission, you basically break a link in the chain. So it always starts with the infectious agent. In other words, the microorganism that's causing the disease, which normally then would be considered a pathogenic microorganism, and the reservoir for that infectious agent, which would be the place where that infectious agent resides. And how that infectious agent leaves the reservoir would be considered the portal of exit. How it is transmitted would be the mode of transmission. And then how it enters a new host, a new person that's going to get the infection, for example, would be that portal of entry, and then that susceptible host is somebody who's actually susceptible to getting that infectious disease. So if we look at this in terms of SARS-CoV-2, the causative agent of COVID-19, the virus, of course, is the infectious agent. The reservoir is somebody who has the virus. The portal of exit we'll talk about a bit more, including the means of transmission and portal of entry. And the susceptible host is that next person who is susceptible to the disease. So when we have an emerging disease like the causative agent of COVID-19, we have a need for information, and you've probably seen that in the general media in the last few months, because we don't always know all those links in the chain for an emerging disease. And so unknowns exist that we have to do scientific studies to understand more what those unknowns are. Some of the unknowns, for example, could be the infectious dose, how much of the virus is needed to cause an infection, the environmental hardiness of the virus. In other words, how long can the virus live outside of the host? Remember, all viruses have to live and multiply inside of cells, so they're usually not very happy outside of hosts. And which individuals are most susceptible? So we go back to that susceptible person link in the chain, and who's really actually susceptible to getting the infection, what modes of transmission we have. In other words, how is that virus transmitted from one host through the portal of exit to the next host through the portal of entry. And examples of how these unknowns are determined are scientific studies. You've probably heard the terms epidemiology. That's one example of a scientific type of study. There's certainly laboratory studies. There's even human experience and data collection studies, such as the type of information that a Department of Health would obtain for a reported infection. So it's kind of a juggling match. You're starting to have an emerging disease. You're starting to figure out what the links in the chain are, and sometimes you know a bit about one link, but you don't know a bit about another link. So you're sort of always juggling this information along with taking precautions until more is known about the links in the chain. What is COVID-19? It's a human disease caused by the SARS-CoV-2 virus, which is a coronavirus. That's just a type of virus. And what we know so far is that older adults and people who have severe underlying medical conditions seem to be at higher risk. There's a wide range of symptoms reported. You can certainly see all of those in the CDC website link you can see on this slide, but they range from mild symptoms to severe illness, and the symptoms tend to appear 2 to 14 days after exposure to the virus. How is the virus spread? Basically two mechanisms, contact and aerosol. So when you think of contact, you think of direct contact with an infected person. You're touching them, you're close to them, or direct contact with a fomite, followed by contact with the face, because the face and basically areas on the face, such as the nose, mouth, and eyes, are portals of entry for the virus. And aerosol spread would be droplets from that infected person. Maybe they cough, maybe they talk loud, they sing, but droplets from that infected person might either directly contact another person's face or maybe are inhaled as they go through the air a short distance to that other person's face. Droplets could also contaminate fomites. So fomite is an interesting word, and if you're not familiar with it in infection control and biological hazards, a fomite is really almost anything. It's any object. Common ones might be a doorknob, for example, but a fomite is an object that might be contaminated with infectious agents, such as bacteria or viruses, and basically serve in their transmission. It's very important to remember that even gloves and masks can become fomites if they're not used correctly. And fomites can become a source of cross-contamination. So if you haven't heard the term cross-contamination before, it's basically a process by which microorganisms are unintentionally transferred from one substance to another, and then in the end to a susceptible host with harmful effect. Using gloves and masks incorrectly can lead to cross-contamination. Tips for using gloves and masks correctly. It's important to remember that just having gloves and masks without correctly using them could give a false sense of security and maybe a false sense of protection. And that behavior and procedures are important for correct use of gloves and masks. While we're doing that, though, other means of prevention are still important. So even when you're using gloves and masks, these other means of prevention we're going to talk about later are still important. There are different types of masks, and then there's a specialized type of protection called a respirator. We're going to talk about the difference because it's very important to understand the different types of masks and different types of respirators. Gloves can provide protection only if they're used properly. This means using them in a way that prevents cross-contamination. If gloves are being used in a workplace to prevent contamination of the hands, they would have a certain donning and doffing procedure. Donning and doffing are words that mean putting them on in a certain way and taking them off in a certain way. Often that means hand washing before donning and after doffing, with careful attention to what is touched by the gloved hands, as any germs on the gloves from the first surface touched can be spread to any other surfaces touched before the gloves are removed. This is what we mean by cross-contamination. While gloves can be important for protection in a workplace like a hospital, where they are frequently donned and doffed for many different tasks, they are not likely to be useful for that general work environment outside of healthcare. This is part of the reason for the recommendation by the WHO, the World Health Organization, for non-medical professionals is that washing your hands regularly is more effective than donning gloves. This is a recent poster from the WHO talking about using masks safely. Note the hand washing and other steps to prevent cross-contamination when donning and doffing fabric masks. A link to this poster will be available at the end of this training. Engineering controls would be ways to isolate people from the hazard. So examples of engineering controls would be the plastic barriers that you often see now in public places. Administrative controls rely on changes in people's behavior. So hand washing is an example of an administrative control because it relies on people to actually behave in a certain way. And then last is what we're going to talk about for most of the remainder of this training, PPE, which is personal protective equipment. Personal protective equipment is actually something you wear to protect the worker or protect the person from the hazard. The biological hazard in this case is the SARS-CoV-2 virus. Applying that hierarchy of controls to COVID-19 means breaking the links in the chain of infection that we just talked about. Remember, elimination is not necessarily easy to do with viruses, but an example of elimination for coronavirus would be a vaccination that makes your population no longer susceptible due to their immunity. Engineering controls would be examples like I already mentioned with plastic barriers or ventilation systems that prevent that aerosol spread. Administrative controls, again, are procedures that rely on certain behaviors such as hand washing, extra cleaning and disinfection, social distancing, and even proper use of masks. PPE are things like N95 respirators, and it is important to note that OSHA does not consider cloth masks PPE. So what is PPE then if OSHA does not consider a cloth mask to be a PPE product? PPE is something that's regulated by OSHA. It's a piece of equipment regulated by the Occupational Safety and Health Administration to meet certain performance criteria. And so PPE, such as hard hats, safety glasses, respirators, face shields, from an OSHA standpoint, have to meet certain performance criteria. And if they're required in the workplace, the OSHA PPE standard must be complied with. That standard can be found at the bottom reference there, 29 CFR, which is the Code of Federal Regulations, at 1910.132. So gloves and other PPE, though, may be needed when you're applying disinfectants for the cleaning and disinfection control for coronaviruses. It's important to note that. And I mentioned that PPE might be something like a respirator, but a respirator is not the same as a cloth face mask. A respirator is equipment worn by an individual in the workplace to help prevent the breathing in of airborne hazards, such as biological hazards like coronavirus. A mask, then, a cloth face mask or even a surgical mask, is not the same as a respirator. So we'll talk a little bit about the difference between a mask and a respirator. Masks are intended to help protect the work environment from substances expelled by the wearer. Surgical masks may also help reduce the chance of blood and body fluids from entering the wearer's mouth and nose. Respirators are intended to help protect the wearer from substances such as airborne particles in the work environment, whether they're industrial or biological or healthcare work environments. It is important to note that if respirators are required in the workplace, the employer must comply with the OSHA Respiratory Protection Standard, which can be found at the reference below, 29 CFR 1910.134, and that respiratory protection standard includes the establishment of a written program and the other things that you see on this slide. Let's apply some of this learning to example controls to help stop the spread of COVID-19. There are guidelines from many agencies with examples of controls to help stop the spread. While guidelines from various agencies are similar and contain the advice on the screen, you must consult your local and regional guidance documents for the most applicable recommendations for your location. But some examples are hand hygiene, hand washing or hand sanitizers if hand washing is not available, social distancing, CDC currently recommends 6 feet, respiratory etiquette, which would include proper use of face coverings, covering your sneezes and coughs, and limiting loud talking, singing, and other things that could generate aerosols. Enhanced cleaning and disinfection. There is a recent CDC decision tool at the link at the bottom of this slide that might help with understanding what might be appropriate for your location. A medical program, such as reporting symptoms, staying home when sick, monitoring for fever, and testing. And then keep in mind, PPE is very specialized equipment, but when respiratory protection or other PPE may be needed, you might implement that in your facility. However, it needs to be done in accordance with OSHA requirements. So what controls should you consider for your facility for COVID-19? As always, consult appropriate guidance because your location might have public health requirements. And it's a good idea to get interested stakeholders together to conduct a risk assessment for your specific site and circumstances and develop a return to work plan. Consider also using behavioral science techniques. Remember, a lot of these controls are dependent on human behavior. An example would be hand washing. And behavioral science techniques can help improve that human behavior dependent control. I mentioned risk assessment, but what is a risk assessment? It really should be thought of as just a structured process to analyze the risk in terms of consequences and probabilities. And it can vary by location, by type of activities that go on in that location, but it provides a basis for decision making about what is going to be the approach for that facility, for that location, for that application. So you can have different things that you would decide on for different applications. For infectious diseases, you'd want to go back to what was covered in this training with links in the chain, breaking links in the chain, and controls. And you'd also want to consult all of the guidance and the public health requirements for your location. CDC and OSHA have some tools for risk assessment for COVID-19. Here is an example of a CDC and OSHA tool. It's an occupational risk pyramid. And it's important to note for non-healthcare workplaces, you really are just looking at the two bottom bands of risk here, the lower risk and the medium risk. The high and the very high are really there for healthcare and medical personnel. And for the low risk, it would be jobs that don't require frequent or close contact. So minimal contact with the public and other coworkers. Medium risk is really just, do you have frequent or close contact with others? If we go to the low exposure risk band, the low exposure on that pyramid for the OSHA guidance, the risk assessment tells us that additional PPE is generally not recommended, and that social distancing, medical, hand washing, respiratory etiquette are more important. Workers, however, should continue to use the PPE, if any, that they would ordinarily use for any other job task that they're doing. And always check your local and national guidance on facial coverings for businesses and the general public. So that's the low exposure risk assessment. If, however, you're going to have some frequent close contact with others, OSHA guidance is that PPE should be determined based on a risk assessment, a PPE assessment, to determine if respiratory protection, for example, might be needed. You would still stick with the social distancing, the other controls that were mentioned in the low exposure category, but here you might think about barriers or other engineering controls. You might improve the likelihood of behavioral controls through behavioral science techniques. You would probably provide even more access to things that would allow for respiratory etiquette, like tissues and cloth masks. And in general, if you need PPE, such as an N95 respirator, it's important to remember the OSHA requirements must be met. There are a number of different guidances and advice documents, and we have links on the next slide for those. So you're encouraged to look through all of these links to help you in determining what your return to work approach will be for COVID-19.